What is hearing impairment? Types and levels of deafness and their implications for speech and language development. To understand why your child has a hearing difficulty, you need to understand what an ear looks like, including the parts inside the head which we don't usually see. The outer ear is the part that we can see and touch. Sound is caught by the outer ear and travels down the ear canal to the eardrum. On the other side of the eardrum is the middle ear. This has three little bones which vibrate, making the sounds louder. Finally, the sounds move into the inner ear, first to the cochlea, which is the part which looks like a snail shell, and then up the hearing nerve to the brain. If any of these parts of the ear are damaged and don't work well, then hearing will be affected. There are several different kinds of hearing impairment depending on where in the ear it comes from. Conductive hearing loss is when there is a problem with the middle ear. This may be permanent, such as if the bones in the middle ear don't vibrate properly, or temporary, such as when repeated colds and infections lead to fluid building up in the middle ear. This type of temporary hearing loss is called glue ear. Sensory neural hearing loss is when there is damage to the inner ear, either to the cochlea or to the hearing nerve, and this is permanent. Sometimes children have a mixed loss, where they have problems in both the middle ear and the inner ear. For a few children, their hearing loss is caused by auditory neuropathy. This is when the ear itself is not damaged, but there is a problem getting the sounds through the hearing nerve or the brain. In the audiology clinic, audiologists test how loud a sound needs to be before your child hears it. The quietest sound that your child can hear is called their hearing threshold. A hearing child will hear sounds from about 0 decibels. If your child's threshold is between 20 and 40 decibels, then they have a mild hearing loss. If it's between 40 and 70 decibels, then they have a moderate hearing loss. If it's between 70 and 90 decibels, they have a severe hearing loss. And if it's more than 90 decibels, they have a profound hearing loss. The audiologists repeat the test for different pitches or frequencies of sound. Then they put all this information on a special graph called an audiogram. Please ask your teacher of the deaf to explain more about your child's own audiogram and which sounds they can and cannot hear without their hearing aids. Children with a mild hearing loss will still hear speech, but they will miss the quieter sounds, especially when they're in noisy situations. They may find it difficult to locate where sounds are coming from. Their speech may be slightly affected because they don't hear all sounds clearly, but they should develop good language skills. They may be given hearing aids to boost up the quieter sounds which they are missing. Children with a moderate hearing loss will only hear very loud speech and may not hear the quieter, higher speech sounds. They will need to lip read as well as listen to help them make sense of speech, and they will need hearing aids to hear speech louder and clearer. Some children with moderate hearing loss have delayed speech and language skills, especially if they don't wear their hearing aids consistently. Children with a severe hearing loss will not hear any normal speech sounds without their hearing aids, although they will hear some very loud environmental sounds, such as someone shouting, doors banging, car engines, and so on. Good use of hearing aids will be essential for them to access speech and learn to understand it. Even with hearing aids, they will need to lip read too. If they don't wear their hearing aids, they will not develop good speech and language skills, and even if they do, they may be slower to develop spoken language than children with normal hearing levels. Children with a profound hearing loss will only be able to hear extremely loud sounds, such as a plane taking off, a drill, and so on. Some may not be able to hear anything at all. They will need very powerful hearing aids or cochlear implants in order to access enough sounds to develop spoken language. Profoundly deaf children usually have some delay in the development of their speech and language skills, but can make good progress with lots of extra help, especially after having cochlear implants. Profoundly deaf children will often benefit from some signs being used to support their language development, especially before they are implanted. Some children have high frequency hearing loss. This means that they hear well in the lower pitches, including lower speech sounds, and worse in the higher pitches, which include sounds like s, sh, f, and th. This kind of hearing loss can be very confusing for parents as they observe that their child is responding to speech without realizing that they are not actually hearing all the different speech sounds. Children with high frequency hearing loss will need hearing aids to help them hear all the speech sounds and let them make sense of speech. They will usually rely on lip reading to access some of those higher sounds too. Here's an example of how hard it is to understand speech if the quieter, higher sounds are missing. Can you work out what the following question is? The correct answer is what is the last letter of the alphabet? If you worked it out, well done, but you'll agree it's much easier when all the letters and sounds are there. Children with high frequency hearing loss usually do develop spoken language, but their speech may not always be clear as they find it hard to pronounce the sounds that they do not hear. Hopefully, you now feel more confident about your understanding about different levels of hearing loss and how your child fits into the different levels and how to interpret their audiogram. If you have more questions about their level of deafness, what their audiogram tells us about their hearing, or about what the implications of their hearing loss might be, please contact your child's teacher of the deaf or their audiologist to discuss any issues raised from this video in more detail.